Hi, my name is Kale Evans. I'm a student here at the Wilson State Nursing Program, and today I will be doing the skill of blood transfusion. So before I start, I'm going to make sure I got and review my provider orders. So here I have Samantha Lewis, a 43-year-old female, born 6/10, 1975. Dr. Annalyn has put in an order for them to transfuse 2 units of PRBCs, as well as get an H&H after 1 hour after the transfusion. I know they'll be getting that because their hemoglobin's a little low at 7.6. So now that that's all accounted for, I'm going to make sure to get all of my supplies before heading in the room. So I'm going to need a flush, some alcohol swabs, some NS here, and this blood tubing. On top of that, I'll also need the consent form and the blood transfusion information sheet. So now that I got all of that, and go ahead and enter the patient's room, introduce myself, provide hand hygiene, and explain to them what we'll be doing today. So, hi there, Samantha. I'll be your nurse today. My name's Kale. Before we get started, can I get you to confirm your name and date of birth for me? Okay, so Samantha Lewis, 6/10/1975. Okay, perfect. I see that you have an allergy. Could you tell me about that? So you're allergic to codeine, okay? Perfect. Okay, so I got so Dr. Annalyn has put in an order for you to get you a blood transfusion. For this blood transfusion, we're getting it because your hemoglobin's a little bit low. It's at 7.6, and we want to boost that up a little bit. So I'll give you this information sheet that you can go over. It's just going to tell you everything about receiving your blood transfusion. Okay. So here's that. And while the patient goes over the blood transfusion information sheet, I'll give them the consent, and I'll make sure they don't have any questions, make sure that they understand what symptoms that they need to report to me if they get it, such as chills, rash, fever, itching, anything like that. And so once I've obtained that, I can then go ahead and start setting up my lines and the NS. So I'm going to make sure that the patient has a patent IV line, okay, so, and also that it is a 20 gauge or larger, and it is a 20 gauge. Okay, so clean it for 15 to 20 seconds. Go ahead and grab my saline flush, connect it, go ahead and unlock it. I'm going to pull back to make sure that I get blood return, but not into the syringe, just into the line, and then go ahead and advance. Make sure to assess for anything, any signs of infiltration. Okay. Anything wrong with that, Samantha? No? Okay. So go ahead and lock it, and disconnect. I can go ahead and start setting up my tubing. Okay. Make sure these are sterile. All of my lock and clamp all of these clamps. And go ahead and bay. Make sure this one's still closed so I don't get any backflow. And then this bottom one is also closed. I can open this one up. Fill the drip chamber. about halfway. Then open this one to make sure that I get a prime line, get all the air bubbles out. Okay. Got all those air bubbles out. And then go ahead and rehang this to make sure it stays sterile so I can be ready to hook up my blood right away, because once I get that blood out of the blood bank, it's only going to be good for 20 to 30 minutes. Past that, I won't be able to hang it. And then before exiting the patient's room, I want to make sure to grab my first set of vitals. This will serve as my baseline vitals. And then once I do that, I've got my consent form and everything. I can then clean up my area and head to the lab. Okay. So I'm going to the lab with my unit tag here, and I'm going to ask the lab that I need a blood transfusion for a Miss Samantha Lewis. They have it here, they got the order. So I'm going to go ahead and confirm with the lab tech, which will serve as my first check. So I got blood here for Samantha Lewis. Donor ID 120708, 120708, date of birth 6/10/1975, medical record number PCS 78500, blood band ID AFN 3889, and I'll make sure once I get into the patient's room to check their blood band. B positive, that's the donor. B positive, room 222, Dr. Andelin, and go ahead here, check the collection date, which is 11/1/2020, 11/1/2020. The cross-match date, which was 11/16/20, 11/16/20. And the cross-match expires on 11/30/2020. Okay. Make sure. Okay. So here's where the H&H on the cross-match is when that was done, 11/16/2020. Okay. So making sure that that's all done, I can then go ahead grab a pair of gloves and go ahead and take this into the patient's room. Before I leave the lab, I want to make sure that the blood isn't discolored, isn't any clots or anything that's floating in it. I want to make sure if there is any of that, that I report that to the lab tech and hopefully get a new blood or new sample. Okay. So I can then enter the patient's room here. And again, introduce myself, explain to them what's going on, and I can then go ahead and verify with my nurse for my second check here. So again, I have Samantha Lewis, donor ID 120708, date of birth 6/10/1975, and we can check that with our patient if they verify their name and date of birth for us. So Samantha Lewis, 6/10/1975. So that matches. We got our medical record PCS 78500, blood band ID AFN 3889, and we're going to make sure to confirm that on our patient. So we have AFN 3889. Okay. We got B positive, and that also is here on B positive. And 11/1/20 is when it was drawn. So collection date 11/1/20. Unit number 0033809, and expires on 11/30/20. And then on our cross match is when it was taken, and that was on 11/16/20. Okay, so that matches all for our second check. Okay. And then I'll do one final check by myself as the third nurse. And just again, go through it again. We got a Miss Samantha Lewis here, date of birth 6/10/1975, donor ID 120708, 6/10/1975, PCS 78500, for the medical record number, blood band ID AFN 389, that matches here, AFN 389. Got B positive, B positive, B positive. And collection date was on 11/1/2020. Crossmatch was on 11/16/20 and expires 11/30/2020. Perfect. So we got all of our checks done. Again, making sure our consent is signed, everything. So then we can go ahead and start hanging our blood. And then I made sure that I got my baseline vitals. I can also take another set now if it's been a couple minutes since, if it took me a while to get from the lab down. Oh, I need this one. Okay, so, got the bottom one here, locked. One be locked. Okay. Okay, so then I can make sure that one's closed, the saline's closed. So to prevent backflow up, go ahead and open up the bloods. Fill my drip chamber with it. Okay. And then I can slowly prime the line with it. Making sure not to lose any blood, but that it just gets towards the end of the line. Perfect. Okay, and then closed, closed, open. And then again, we can ask the patient how they're feeling, if they have any questions before we get started. They're all fine. I've made sure that I have the correct patients. So Samantha Lewis at 6/10/1975. They've confirmed their allergy to codeine. We're not giving codeine today, so that's fine that we can give this blood. We've done our 3 checks. Open that up. And then we can start our, go ahead and close this one. I'm gonna open this one. And then I'm just gonna adjust this to my drip rate to be at about 15 to 20 for the first 15 minutes so that we can monitor for any adverse reactions. If they start feeling the chills, the fevers, the itchiness, anything like that. We're gonna stay in the patient's room with them for 15 minutes. After that first 15 minutes, we're gonna take another set of vitals. If they're good and if they're checking out, then we can then go ahead and up our rate to the prescribed dose of 175 mils an hour. Once we do that, we can then make sure the patient's comfortable, ask them if they have any questions. We can then exit the room and check back periodically with them every 15, 30 minutes just to make sure they're doing, and go ahead and continue to take vitals per facility policy. We got to make sure that the transfusion is ran within 4 hours, as blood is only good for 4 hours after it's been taken out of the lab. And then, times pass, our blood transfusion is complete. So then we can go ahead and enter our room again, introduce ourselves again, make sure that our patient's doing all right, ask them if they got any weird feelings, anything like that. No, they're feeling good, okay? So we're gonna go ahead and glove out, perform hand hygiene. And we're gonna make sure that's open. We're gonna shut off our blood here. And then we're gonna go ahead and open up our NS. Make sure it flushes the line. Make sure all of that blood that's been given to them, they get all of it. And make sure that we flush the line all the way down till we just see clear. Making sure that they have their paid IV line. Once that's done, we can then shut it. Lock it down, and then we can lock our patient's IV site and unhook them. And then with our tubing and blood units and everything, we're going to make sure to discard that in a biohazard bag per facility policy. We're going to make sure our client's resting fine. They don't have any questions for us, that they are feeling good. They don't have any of those side effects that we were talking about earlier. And then we're going to go ahead and deglove our hand hygiene and make sure to take one last set of vitals post after the transfusions ran, 15 minutes after the transfusions ran. Make sure that those are all good. There's no abnormal values. And then we're going to go ahead and exit the patient's room after make sure they're all feeling good, and we're going to document the transfusion, the site that we did it, how long it took, the vitals at the various stages. We're going to make sure the time, the amount, and I do believe that is everything.